give a few details on the speaker. There's two of them, but I'm going to introduce Dr. Anwar first, and then she's going to introduce the other speaker. Dr. Anwar is a medical graduate with public health training from Pakistan and clinical research training from Canada. She's an author, speaker, and entrepreneur. She's dedicated to tackling global health challenges. As director of DMY Health, she leads initiatives in Canada and Pakistan focusing on disease prevention, healthcare system through research. Her work spans environmental health, mental well-being, and health system resilience. As a member of the Association of Pakistani Physicians in Canada, Dr. Anwar is spearheading efforts to support initiatives for Pakistani communities. So thank you very much for your service, and let's welcome Dr. Anwar.
Thank you so much for the very kind introduction, Dave. And it's a great honor for me to stand before such a distinguished audience of leaders and change makers and philanthropists. I'm happy to introduce my sister, Dr. Khushbakht Anwar. She's a medical doctor from Pakistan with a public health specialization from London School of Hygiene and Tropical Medicine, UK. She also is certified in project management from University of British Columbia, and she's working as a project officer in Red Cross Canada. With us in our health, she's working as a consultant for project management in Pakistan.
Polio, a disease we were so close to eradicating. Yet in 2024, Pakistan reported 74 new cases of wild poliovirus type 1. Why is this crippling disease still a threat? And what can be done to stop it? Pakistan remains one of the last two countries where polio is still endemic, alongside Afghanistan. In 2024, Balochistan saw 27 cases. Khyber Pakhtunkhwa had 22. Sindh reported 23. And both Punjab and Islamabad had one case each. Additionally, 493 positive sewage samples were recorded nationwide. Pakistan has mass drives and the expanded program on immunization. In 2024 alone, $185 million was spent on polio eradication. Despite mass vaccination campaigns, polio continues to spread. What's going wrong? Eradicating polio isn't just about vaccines. Challenges like misinformation, political instability, and security threats make it harder to reach the last few cases, but these challenges are not impossible to overcome. What can you do? Support vaccination campaigns and spread awareness. If every child gets the vaccine, the world can be polio-free.
And we'll discuss under three main ones. Number one is the program design and leadership. Second is the system and the environment in which it's delivered. And the third is the community response. It's not owned by the government. There is lack of nationalization of the program. There is extreme reliance on third party and donors. Leaders, the local leaders are not seen leading it, and the true ownership of a program needs that the political leadership is there at forefront. There should be local funding, there should be local strategy development, and this is not being seen. And this is why the Pakistani population sees this as a foreign program. They see that it's being designed by some foreign teams, and they don't feel like following it. The donors have played a great role. The international community, the global community has been putting pressure, and they have been giving the funding, which has played a great role. There are some issues that they have mostly applied the strategies that worked in the best. The local feedback is not included, and this keeps happening every year. Teams are there, the provincial, the teams are there, but because the program is being led by the third party, so the teams that are led by national committees, they are not effectively working for the issues of the polio birthing. You can see this papered map So this kind of methods are being used in the polio program. The latest technologies like geographic information system mapping, which is used these days in other public health programs. And dengue control program in Pakistan is a great example. When the government wanted to control dengue, they used the best methods. They used the latest technology, the geographic information system mapping. But this is missing for polio program. The paper maps are being made and there is no GPS tracking of the vaccinators, which could have actually helped because we have such a diverse geography. We need a digitalization of the program. And Nigeria has done that. They had digitalized their program and after that there was great impact in polio reduction. And many people say that because the polio was eliminated in the West, so when something is eliminated in the West, there is no more research and innovation for that disease. And so sometimes they say that there's no more innovation in polio for these countries. But more important is that the system is also very complicated. The environment that we have in Pakistan, it's not very conducive. There's a complex interplay of different challenges like conflicts, the poor health infrastructure, and there are some other operational challenges. There are high-risk areas. Almost half of the cases are linked to these high-risk areas. Why these are high-risk? Because there is high-density population, there is poverty, malnutrition, which makes the children further susceptible to having polio. And there is frequent movement in these areas. And last year what happened was that Pakistan government started some expatriation efforts for Afghan population, and they started hiding and they started internally they displaced into these high-risk areas. And these areas, it was always very challenging to eliminate polio in these areas. And there is cross-border transmission from Afghanistan between two countries, and there are polio centers there, but not in all the borderline. Then there are security issues and attacks on vaccination teams, and in these years there have been 200 polio workers have been killed, and these are in the regions of Fata and KP, which is the north of Pakistan. Our health infrastructure is weak. When polio team some children get missed by the mobile teams. If they have taken vaccine through the routine immunization, they could have been protected. But the routine immunization is also not covered completely. So this is further challenging. The synergy between the polio program and the routine immunization is weak. And sometimes we have issues like workers' strikes and low incentives, that they are not motivated to work, and these lack of resources make some things further complicated. There are some cases where the children have taken the vaccine from door-to-door teams that come, but even then they had the polio. So some say that it's maybe because of the cold chain maintenance. And that's because we have such a vast geography, and teams have to go to such far places. Sometimes there are electricity supply issues, due to which the cold chains cannot be maintained. Now after this, I will invite Dr. Khushbakht.
I'm going to expand more about the community challenges because, as Dr. Bushra has briefly mentioned, any program, it cannot be successful until it is tailored to the local context. And I think we have a very recent memory of COVID-19 pandemic. In our memories, we have seen that countries that had great health infrastructure and great policies, they were still hurdled by the uptake within the community and the vaccine hesitancy. And these areas in Pakistan where you see the upsurge of these cases, these are very unique in their context. These are remote areas, these are areas lining the Pakistan border. So these areas, they have very difficult geography in terms of the landscape. These are hard to reach, they have low education, and so there are specific contexts that we need to understand. So for example, the biggest hurdle is vaccine hesitancy. So people in these areas, they think that these vaccines are going to cause infertility in children. It's going to cause weakening of the natural immunity of the body. And there are other barriers, for example, within the unique context of Pakistan, like for the political context, it doesn't help that we had a fake hepatitis B vaccination campaign back in 2011, and the purpose of that campaign was actually to go door to door to identify and catch Osama bin Laden. So that is also an example which the people use to then further say that these are methods to spy or like Western propaganda. So these are the unique challenges that we need to address so that we can tailor our program to that local context. There are other reasons as well for refusing vaccinations. For example, many communities sometimes they refuse vaccinations because they want to use that as a leverage against the government to have their demands met. And then of course the cultural barriers. So many of these remote areas, Pakistan being a conservative society, in many of these remote areas, women and children, they don't want to get vaccinated from men-only teams. So they want lady health workers to do that. But given that these are hard to reach areas, these are remote areas, not all of these teams can have women health workers on them. So mostly it's the men-only team. And that's why it does not take into that local context that needs to be understood for these programs to be made more effective. So I want to emphasize here that despite these challenges, the country and the health workers, they are dedicated. So we have great examples of heroisms from especially our lady health workers. We have examples where we have seen them traversing through flood areas, going through makeshift chairlifts to cross from one mountain to another just so that they could reach these villages and vaccinate the people. So yes, we have a concern that these cases have risen in the past years, especially because of the disruptions caused by COVID-19 pandemic. But we also have hope because our healthcare workers, they are dedicated. We have seen actually a decrease in 2021 to 2022 with these cases going down. So in that way, if we can have these programs tailored to local context and understand what the challenges are and how we can uptake that vaccination, I believe that we can actually win this battle against polio. Dr. Bushra, I think you have.
I want to emphasize. Here you can see there's it's a portal online, Google Trends data. It's available online. This portal can be used to monitor what the public in Pakistan is searching, and we can predict the myths, what myths are prevalent there. So we need to monitor the misinformation in digital spaces in Pakistan. This is what I want to suggest alongside doing the research. This is missing currently. I have not seen public health organizations focusing on this. I tried to analyze as in the data online. So you can see the polio cases in these orange bars. These are polio cases, and the green line is of research. So as the research increased, the polio cases, you can see there was a drop. And this is actually important. Unless you do research, you cannot find the evidence-based strategies to reduce the disease cases. And the second chart is specifically for Pakistan, and in those years when you see the polio cases had dropped, you see the green line going up. So the research was more in that time. And now the research line, you can see there is a drop. So research is less now. So I'm a strong advocate of research, and this is what we have been doing in Health. We have shared the brochures also. We have been trying to strengthen the indigenous research in Pakistan. We have been trying to train our people in research, and research has a strong relation with reducing the disease number. I suggest that we have funding every year, but we need to realign. We need to make our program more research based, in having some innovation, adding addressing these factors that have been missed in the last years.